I'm Russell Vinik, Medical Director at GBS Benefits, and today I'd like to talk to you about osteoporosis and bone health. So, what we'd like to go over today, number one, define osteoporosis. We'll talk about the complications, how to prevent it, how to screen if you have risk factors for osteoporosis, and then very briefly, we'll touch on treatment of osteoporosis. So, what is osteoporosis? It's a disease and it's characterized by loss of bone. We've all seen people walking on the street that are hunched over, and the reason that people most commonly why you see this is from osteoporosis. It can affect all the bones in the body, but the spine is very common. And you can see in a case like this from this image that this patient has multiple compression fractures, which causes their spine to bend over and that hunched over look. But it's not just being hunched over. There's a lot more complications related to osteoporosis. So we all, as we age up to about age 30, our bones grow and get stronger. Then what happens is we develop a slow decline in our bone strength from age 30 onwards. Women, particularly after menopause, then they have a much more rapid decline in bone strength, leading to osteoporosis more commonly in women than men, but it does happen in both sexes. When someone has osteoporosis, the most common place that we see complications is in the hips, the vertebrae, and the wrists. And you can see here this image of a normal hip on the left and an osteoporotic hip on the right. Hips are particularly worrisome because hip fractures in the elderly not only carry a lot of morbidity, but also mortality. The average life expectancy after an elderly person suffers a hip fracture, about 20 to 40% don't make it through the next year because of all the debility associated with that hip fracture. So, prevention of osteoporosis. Recognizing that this is a disease that occurs over a long period of time. So, thinking about your bone health early. There's still not an exact number for calcium, but the general recommendations is men and premenopausal women should get about 1,000 milligrams a day of calcium. And that's a combination of in your diet and or supplements if you need them. Postmenopausal women, the recommendation is about 1,200 milligrams a day, but also you want to try to avoid taking more than 2,000 milligrams of calcium because that can have complications as well. So there's a lot of dietary tables that you can find online, but a general rule of thumb is you multiply the number of daily dairy servings you take times 300 will give you a good estimate of how much calcium you're getting in your diet. In addition to calcium, vitamin D is very important to have in our diet. And the recommendations for that is men under age 70 and premenopausal women need about 600 international units per day. And then men over 70 or a postmenopausal woman should get about 800 international units a day. So lots of dietary supplements are on the market. I'm just showing you a Oscal, which is a common one. Most of these will contain around 400 to 500 milligrams of calcium and then around 200 international units of vitamin D. So if you're not getting enough calcium or vitamin D in your diet, then a supplement that has both can be very beneficial. Also, it's important to realize exercise helps improve bone metabolism, but not only that, but vitamin D is metabolized to its active form by sunlight. So getting outside definitely will help with your vitamin D metabolism. So how do we screen and who should be screened? The most common scan that's done is called a DEXA scan, and you can see a diagram of this up here. It's a very simple test. You lie on a table for about 5 minutes, and it tests your bone mineral density, and then it gives a what we call a T-score, which helps measure how dense your bone is compared to people of normal bone strength. So who should get a DEXA scan? So generally, any woman over age 65 or women under age 65 with risk factors for osteoporosis. So here are a few of the major risk factors. If you've had a previous fracture or glucocorticoid, which is a type of steroid treatments. If you've parents have had a hip fracture, low body weight, smoking, excessive alcohol intake, inflammatory diseases like rheumatoid arthritis. And then there's also a lot of secondary causes of osteoporosis: hypogonadism, premature menopause, malabsorptive states, liver disease, inflammatory bowel disease. So that's a lot to talk about. You can see I have an online tool that we use a lot in medicine called the FRAX tool, which can help give you your individual risk score of developing osteoporosis. For men, there's no clear guidance of when men should get a DEXA scan, but generally, if the man has significant risk factors like the ones we just highlighted above, or loss of height, more than 1.5 inches of height loss is a risk, or if they've had low impact fractures, like a minor fall resulting in a fracture is a concern and should prompt evaluation for osteoporosis. Treatment. I'm not going to go into details about treatment because it is pretty complicated, and there are tons of treatment options, and they really need to be individualized between you and your healthcare provider. The mainstay of treatment we have is a drug class called bisphosphonates. You've heard of Fosamax. There's also an IV form of Zometa. Of course, whenever we give these drugs, we want to be sure someone's getting adequate supplies of calcium and vitamin D. But then there's also other drugs that can be used in select clinical circumstances, like hormones. We mentioned how osteoporosis is very common after menopause. So in some cases, estrogens or even testosterone can be added. And then there's a class of drug called bone growth stimulators. And once again, many other options. So a diagnosis of osteoporosis isn't the end of the world, but it might be if you don't get it treated. So, summary: osteoporosis is a silent disease. A little bit of attention can go a long way into preventing some pretty significant complications. So I thank you for joining me today. I hope you have a good day, and I look forward to seeing you next time.